Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Pulmonary Function Testing. Introduction. Many people need to have a pulmonary function test, or PFT, performed at some time in their life. Your healthcare provider may have requested that you have a PFT. A pulmonary function test, or spirogram, helps healthcare providers find out how a patient's lungs are functioning. A PFT can also predict whether certain medications may improve lung function. This program explains pulmonary function tests and their benefits.
Anatomy. The lungs are very important organs. They help us breathe in oxygen and breathe out carbon dioxide. Everyone is born with two lungs, a right lung and a left lung. Breathing in is also called inhaling. Breathing out is also called exhaling. We breathe air in through the nose and mouth down the windpipe into the bronchi or lung air passageways. The bronchi divide into smaller passageways called bronchioles, which also divide into smaller sacs called alveoli. In the alveoli, blood gets rid of carbon dioxide and picks up oxygen from the air we breathe in. The alveoli are lined up beside very small blood vessels.
A thin membrane is all that separates the blood and air in the lungs. Since the membrane is extremely thin, oxygen is able to diffuse into the blood and carbon dioxide diffuses out of the blood.
Many diseases can affect the lungs and how they function. When lungs are affected by diseases such as asthma, emphysema, or COPD, it is more difficult to inhale and exhale. Pulmonary Function Test. A pulmonary function test helps doctors to evaluate the health condition of the lungs. A PFT is an outpatient procedure, which means that you will be able to go home the same day. You will be asked to sit down and breathe in and out of a pipe. To prevent air leaks, a clip may be applied to your nose. The nose clip does not hurt. A computer will record how much air you inhale and exhale. It will also measure how fast the air flows as it enters and exits your lungs. Sometimes it is important for the patient to take medications that help the bronchi and bronchioles open up. These medications are called bronchodilators. The PFT is given again after taking the medication. Other medications that make the bronchi and bronchioles smaller may also be given and the PFT repeated.
The graphs generated by the computer are called flow volume loops. You may want to look at them and have your healthcare provider explain them to you.
A PFT is not painful but may be slightly tiring, especially if you have lung problems. This test may be repeated over the course of several years to monitor how your lungs are functioning and if any treatment is working.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary.
A pulmonary function test helps doctors to evaluate the health condition of the lungs. You will be asked to sit down and breathe in and out of a pipe. A computer will record how much air you inhale and exhale. It will also measure how fast the air flows as it enters and exits your lungs. A PFT is a pain-free test that can help your healthcare provider decide what kind of treatment you may need. PFTs also help healthcare providers track the progress of diseases and treatments. With the help of a pulmonary function test and your cooperation, Your healthcare provider may be able to better treat your lung condition so you can go on enjoying life. Thank you for using Explain.